All right, today we're all playing the part of medical detectives. We just been handed a pretty urgent case file, and our job? To solve the serotonin syndrome mystery.
Okay, let's jump right into the scene. We've got a patient in real distress. She's confused, her heart is racing, her muscles are rigid, and she's sweating a lot. And all of this happened just a few hours after she started a new medication. The clock is absolutely ticking here, so our investigation starts right now. You know, like any classic whodunit, we have our evidence, the symptoms, the timeline. So now it's time to do what any good detective would do. Line up the usual suspects. Let's get our suspect board up and running. First, we have rhabdomyolysis. That's a severe breakdown of muscle tissue. Then there's salicylate toxicity. Think something like an aspirin overdose. Our third possibility is a dystonic reaction, which causes these intense involuntary muscle spasms. And finally, the one that the early reports are pointing to, serotonin syndrome. Let the investigation begin. Okay, the early evidence seems to be pointing overwhelmingly in one direction. So let's build a profile for our prime suspect, serotonin syndrome. So, what's the deal with serotonin syndrome? What's its MO? Well, it's a pretty dangerous reaction where the body just gets flooded with way too much serotonin. It's kind of like turning the volume on your entire nervous system up to 11. It just causes this massive overstimulation. And that word, idiosyncratic, it's just a fancy way of saying it's a rare and unpredictable reaction. Not everyone who takes these drugs gets it. And here we go, our first really critical clue, the timeline. See, this isn't some slow burn. The symptoms? They explode onto the scene, and fast. Usually within 6 hours of taking a new serotoninergic drug or upping the dose. This fits our patient's case like a glove. Now, to really pin this thing down, investigators look for a classic pattern of evidence. They call it a triad of clues, and it almost always points straight to serotonin syndrome. This right here, this is the classic signature. First, you look for cognitive changes, and our patient's delirium? Check. Fits perfectly. Second, autonomic instability, which is when the body's basic systems just go haywire. That explains the racing heart, the high blood pressure, the sweating. And third, neuromuscular hyperactivity. That's where the rigid muscles and even things like lockjaw come from. Our patient is a textbook match on all three. So what kind of drugs can actually trigger this? Well, the list is long, but it's dominated by antidepressants like SSRIs, which includes Zoloft, the exact drug our patient just started. You'll also see it with MAOIs, tricyclics, and even some stimulants and opioids. The motive and the means are starting to get crystal clear. But hey, a good detective never gets tunnel vision, right? Before we officially close this case, we have to check the alibis of our other suspects. Let's see if their stories actually hold up. All right, let's start the interrogation. Dystonic reaction. Sure, you can explain the rigidity, but what about the delirium and the hypertension? You can't. Your alibi is solid. Next up, salicylate toxicity. Your MO is ringing in the ears and rapid breathing. Totally different from our case. You're clear. And rhabdomyolysis? You're not a known accomplice of SSRIs like Zoloft. The evidence just doesn't connect you to the scene. We've looked at the evidence, we've profiled our main suspect, and we've ruled out all the others. I think it's time to put all the clues together and make the final diagnosis. So we've seen all the evidence now. It all really comes down to this one undeniable pattern, a pattern connecting the drug, the timeline, and the symptoms. Do you see it? This, right here. This is the smoking gun. When you see this specific combination, the mental changes, the unstable vital signs, and the muscle issues, all showing up within hours of starting a drug like Zoloft, the alarm bells for serotonin syndrome should be ringing loud and clear. And with that, the case is officially closed. When every single piece of evidence points in one direction, there's really no room for reasonable doubt. The diagnosis is serotonin syndrome. Let's just lock in this key takeaway. Remember the number 6. That super rapid 6-hour window for symptoms to appear is one of the most distinctive clues you're going to get. And you know, this isn't just some interesting puzzle. In the real world, recognizing this pattern isn't about solving a case. It's about saving a life. Recognizing it quickly leads directly to the right kind of supportive care, and every single second counts. So really, this case wasn't solved with some high-tech lab test, but with clear-eyed pattern recognition. It really makes you wonder, doesn't it? How many other medical mysteries are out there just waiting for a detective who can see the pattern that's hidden in plain sight?